So these are what we think are 7 key healthy homes principles. It's not meant to be an exhaustive list. You can probably think of some other things, but the idea is that if you observe these 7 things, you keep the home dry, clean, ventilated, pest-free, safe, contaminant-free, and maintained, you will have multiple health benefits. And when I first explained this to Senator Mikulski back in '99 when we were launching the Healthy Homes Act, she basically said she didn't get it initially. She became a supporter, but she said, I don't want snappy slogans. I want programs that help people. So you go keep doing what you're doing with lead. Once you fix that, you can move on to something else. She finally got this because we were able to say, well, let's take one example. Suppose you control your moisture in the home. That takes care of your lead paint problem in part because we know moisture is a leading cause of premature paint failure. It deals with injuries from trips and falls from structural rot. You deal with asthma and respiratory diseases from mold allergens, pest allergens and pest intrusions are related to asthma, along with, there's also some evidence that if you reduce moisture, you reduce your radon incursion. So out of controlling this single intervention, you have these multiple health benefits. So it makes sense, it's a good idea. There is a body of evidence that I'm not going to have time to go into, but I want you to know it's substantial. The World Health Organization published a book using mostly European data that quantified the environmental burden of disease related to inadequate housing, and it's huge, is the short answer. But there's also been a review of not only how diseases are related to housing quality, but if you change something in the house, how do you know that it actually works? So the Centers for Disease Control in my group took a look at the scientific literature, both clinical, environmental, and self-reported health, and looked at the interventions that we know to be effective that should be implemented. And so you can read that report. And then there are a number of what I'll call cohort studies. These are smaller, more well-developed studies that showed the health consequences of improved housing conditions, and we're able to quantify it. So that's the environmental burden of disease report, and I guess you're not going to be able to see this, but basically what we did is to look at the relative risk from each particular item, and then look at the population attributable fraction due to the prevalence of those hazards in the housing stock, and then come up with disability-adjusted life years and premature fatalities for each of these things. So on the left, we looked at mold, dampness, and their association with asthma, lack of window guards, lack of smoke detectors, indoor cold, I can't read, traffic noise, and ischemic heart failure, and mental, residential secondhand smoke, lead, indoor carbon monoxide, formaldehyde, and indoor solid fuel use. And you can, for each of these things, we were able to quantify the disability-adjusted life years, which have a dollar value associated with them, as well as premature fatalities. So this is one sort of cohort study that was done in the so-called Breathe Easy homes. This is public housing in Seattle. This is Jim Krieger's work out there. But basically, they introduced moisture controls in the building envelope, used enhanced ventilation, improved temperature control, low volatile organic compound finishers. They also did some training with the residents through community health workers. And after 1 year, they showed nearly 5 asthma symptom-free days for every 2-week period. That's huge, right? 5 days out of every 2 weeks period, and a 42% reduction in urgent clinical care. So you were able to reduce your trips to the emergency room, which cost thousands of dollars, right, by simply doing this improved housing condition. We did a study in Boston, Chicago, and actually also New York City, looking at weatherization. This is a common housing improvement technique in the country, right? And we looked at the associated weatherization and improved overall health. This is a general health score, which is measured on a 5-point scale. And you see that for the health improved, for excellent, very good, and good health, and the prevalence of poor health and marginal health decline. So weatherization, done properly, showed an improvement. Now, I'm older, I have enough gray hair to remember the 70s when we had our first energy shock. And in that era, they weren't paying attention. They were sealing up building envelopes, but not necessarily thinking through ventilation. And so we ended up growing mushrooms in people's basements, right, which was not a good thing. So the newer weatherization integrates better ventilation and has health improvements. We looked, this is the Moving into Green Healthy Homes in Chicago. This is another study we did. This is the, as some of you know, Chicago had, with a few exceptions, maybe the nation's worst public housing, right? So much of that was torn down. It was replaced with this new green, healthier housing and incorporated a number of these features. So the results were that 61% and 65% of children had reduced asthma. They also had fewer headaches, sinus infections, less urgent care or emergency room visits for childhood asthma, fewer missed school days and work days due to asthma. And we also had a control group in this particular study where we looked at another housing development that had been rehabbed but not using green healthy housing principles, but just sort of your traditional rehab. And so you see the same kind of pattern, that improved general health for both children and adults, as well as improvements in mental health, anxiety, depression, and the like. We saw statistically significant improvements, along with angina, hay fever, and sinus problems. So again, showing that a rigorous approach to looking at these sorts of interventions with control groups is effective. There's also some evidence that, as you know, we're faced with an obesity epidemic in this country. There are certain things that we can do with housing and communities, perhaps, to mitigate some of that epidemic. So things like active commuting can reduce the risk of cardiac disease by somewhere between 11 and 31%. Adults are 25% more likely to be active when they think their neighborhoods are safe. So it's not enough to just fix the house. You may have to take some neighborhood level interventions as well. Putting in sidewalks, playgrounds has been shown to be effective, as long with stair climbing. So these are sort of embodied in the active design guidelines, which I encourage you all to take a look at. But here's a Arbor House, and this is a new sustainable green building that incorporated low income, believe it or not, I know the pictures won't be believable, but it incorporated indoor fitness centers for $85,000. So we went to look at the costs here. It also had active outdoor design areas, playgrounds, walking paths, and the like, including rubber surfacing, fitness equipment, better signage, planters, and making the outdoors more attractive for residents to actually partake in. That's sort of what it looked like in the outdoor area. And then they also had bike storages so people could promote increased use of bikes. There was efforts to promote walking by making sidewalks more attractive and installation of artwork and the like. They also put in a rooftop hydroponic farm, which not only reduced cooling and heating costs in the building, but also produced food that the residents and others could eat. So these are the cost items. It basically turns out to be about 1.8% of hard costs of rehab. So, you know, it does cost a little bit more to integrate all this stuff, but not much. And there are huge health benefits to doing this. So these are some general ideas that I thought I'd throw out on the table for local communities that want to take a stab at trying to explore how do we actually connect these two worlds. Maybe we should use some mapping technology so that we understand where health threats and housing defects are most prevalent. We have pretty good surveillance systems in this country for health, right? We track patients and we figure out when they're in and out of the system. We don't really do that for housing. So I remember once I was testifying before Senator Jack Reed of Rhode Island, and he says, I have a house in Rhode Island that's poisoned not one, not two, but 5 families of kids for lead poisoning. What's HUD going to do to make sure that same house doesn't poison the 6th child? And the fact is, in a lot of cases, what we do is we move the kid out, and then the house doesn't actually get fixed. So having a surveillance system, like we do for patients, but for housing, would make a lot of sense. Developing mitigation strategies that are cost-effective, creating multidisciplinary task forces. I'm a big fan of enterprise green community standards. These are the ones where a lot of the research has been done to quantify some of the health improvements. encouraging a wellness trust, encouraging partnerships with medical institutions. These are sort of kids kissing cousins, but a brief story. The governor of Oregon, I think it is an MD, and he tells this story of an elderly woman with COPD, chronic obstructive pulmonary disease. She comes into the ER 20 times. And he says, we did what we always did. We treat her symptoms and we release her. Well, her real problem was that she lived on the top floor. She didn't have an air conditioner. So if the hospital, and every time it got hot, her symptoms got exacerbated, she'd show up in the ER and we'd treat her and release her. But had the hospital simply bought her an air conditioner, we would have saved thousands and thousands of dollars. And yet hospitals aren't geared to buying air conditioners. That's not really what they do. So trying to find ways to develop that disconnect or mitigate that disconnect is important. Focusing on wellness centers, I think you'll hear some of that on the panel discussion. And then a new emerging area, I'm on an Institute of Medicine panel at the National Academy of Sciences that is charged with looking at integrating health into not only immediate rescue operations after a disaster, but intermediate, short, and long-term recovery. And right now, the health angle is not really thought through. So obviously we want to rebuild quickly, but maybe not exactly the same way. Maybe we should build it back better so that some of these health consequences are diminished. So this is the 1985 housing and health standards that were released by CDC and the American Public Health Association. In some ways, they became the precursors of the model codes that we saw in the late 80s and early 90s. But until recently, it hasn't been upgraded. Or updated, I should say, until this year. So we released, again with the APHA, a national healthy housing standard that we hope local jurisdictions will consider as they develop their codes. And this is sort of the way it's written. I'm only going to take the example of radon. It's written as code language. So that it can be integrated into existing codes. So radon present at levels above the EPA action level of 4 picocuries per liter shall be deemed to be hazardous. That'll be determined by an approved method. It'll be mitigated by a qualified radon mitigation specialist, and so forth. And then, so there are these sort of basic requirements, and then there are also these so-called stretch provisions. There's some evidence now that the EPA standard is not as adequately health protective as we would like, so one stretch provision is to go down to 2 picocuries per liter instead of 4. So I encourage, and the standard also has references so that we have the scientific evidence that backing up the suggested model code language. So there's a plan to sort of integrate this work into first the federal housing quality standards and other similar systems, and then also for local jurisdictions. Some of you are aware of this, the Healthy Housing Challenge. This is a partnership between Rebuilding Together and my group, funded by Wells Fargo Foundation and Freddie Mac. And basically, this is about enabling the affiliates, these are basically volunteers improving housing, to work together and to provide some training and some quick fixes on health-related housing and problems. So these are some of the tools that are available. Repair and rehab training. There are 22 safety and health goals that are established there. A process by which we assess the particular housing unit, and then specs for some common repairs. There's a managing electronic tool and a fundraising toolkit as well. So take a look at that as well. It's very exciting work. So basically, we need to have strategies that first identify where the problem is most severe, find solutions that are cost-effective and can be scaled up across the country, provide incentives as well as requirements to promote these best practices as green and healthy housing rehab, and to achieve health via affordable housing, community development, and integration with health systems. So to conclude, we're still at a crisis stage, right? We still have very high costs of health care and health insurance. We have an ongoing mortgage crisis and an affordable housing crisis. We want to get our people back to work. So in my view, these are all flip sides of the same coin. And we ought to be at the table when there's talk about stimulus or investment or where we need to put our resources. We should be saying this effort to improve the connection between housing and health and invest in housing stock makes enormous sense. We should act on what we know. We should make those investments and make them feasible. So energy, this is part of a larger issue. It's not just about our economy, but it's also about if we improve our housing stock and do it thoughtfully, we will have important consequences associated with climate change and energy retrofits. So I'll close with this. This is the Universal Declaration of Human Rights. It was enshrined by the UN back in the 40s. You all see the Roosevelt PBS show, some of you? Well, they go through how Eleanor Roosevelt had a lot to do with this. But it basically says everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and medical care. So we've signed this, right? This is something that we observe. It's a basic human right, and we need to make sure that our investments are consistent with that. If we don't make those investments, we're going to end up the way of Greece or Ireland. We need to make these investments so that we do the right thing both in terms of financing as well as suffering. So that's sort of a thumbnail sketch of the field. There's a lot more to be said, but take a look at the Healthy Homes Challenge, and I want to congratulate the organizers for this conference. This conversation is going on around the country. HUD has, I'll close with this, and maybe it'll sort of feed into our panel discussion here. HUD sponsored something called asthma summits in a few jurisdictions, Cleveland, Kansas City, and elsewhere. And so we'd have this sort of interesting dynamic where all the insurance providers would come to the table. We would present the evidence that, you know, if you do an asthma intervention or some other housing intervention, this is how much money you're going to save in healthcare expenditures. And they'd kind of look at us and say, well, that's very interesting. And so the point is, well, you should reimburse some of this stuff, whether it's home visits, housing inspections, it's part of what you should do. And they said, well, you need to do scalable research. You need to really prove that it can be scaled up. You have these small studies, but we don't really know if it's going to be a large-scale effective approach. So I think that's where we are now. They're sort of there, the evidence is there, but we need to operationalize it. And that's why I think the work that you're doing in communities like this is so essential. You'll have lessons to learn on how you can operationalize it. But this is sort of an intersectoral collaboration. I went to a conference where a school principal was there, and he said, well, you know, people need to think outside their own box. 20 years ago, he said, nobody thought that schools should be about feeding children. And yet we do that now because if children are hungry, they can't learn, right? So now schools feed them. It's not really part of their central mission. They should be about education, right? But in the same world, the housing and health worlds sort of need to think through how exactly do we collaborate? How exactly do we communicate with each other so that the interventions that we do benefit both of those worlds? So, thank you.